natural medicine really has gone into the mainstream. To say otherwise is definitely a misconception.
Way back, conventional medicine has had its origin way back into existence, and natural medicine was struggling in Nigeria as far back as the 70s and 80s. Natural medicine did not get, or gain prominence.
Natural medicine is a good medicine because I prefer it more than tablet or any other drugs.
Ògùn ìbílẹ̀ ẹ̀dá àmọ́ àwọn tó ń ta ọtí lórí títì yẹn wọ́n ti bà ògùn ìbílẹ̀ jẹ́. Àmọ́ àwọn tó lọ sí school nípa ẹ̀ tó jẹ́ pé wọ́n lọ kọ́ ìmọ̀ nípa ẹ̀. Àwọn ẹni wọ́n ń ṣe ìgbìyànjú láti jẹ́ kí àṣàlẹ̀ wa kó má bàjẹ́.
If we learn to distinguish between herbal medicine and alternative medicine, we'll get a clear distinction. Alternative medicine is all encompassing. Herbal medicine is just a branch in natural medicine or alternative medicine.
Welcome to this episode of The Heart of the Matter. Today we're talking about natural medicine and how we can transform healthcare delivery in Nigeria. Today my guest is Dr. Mobolaji Balogun, who is of the Iris Medical Foundation, which is a natural medicine-based institution. Welcome, Mobolaji, to The Heart of the Matter.
Thank you so much.
Natural medicine. I thought that when you go to the man who has a stethoscope around his neck and he prescribes Panadol or something, or that was natural medicine. What is natural medicine?
Well, natural medicine actually is an alternative system of healthcare which focuses on natural remedies and methods.
Okay.
And in natural medicine, we emphasize surgery.
Okay.
All invasive procedures, they're not part of our purview.
Okay.
Yeah.
Did you receive a training to be able to identify what remedy goes for what ailment and so on and so forth?
Yes, there are actually schools that train naturopaths in other parts of the world. We are not privileged yet to have a standard system of training. We had to travel overseas to receive our training.
Does one have to learn orthodox medicine first before you can do natural medicine? Naturally, you need to know where the appendix is, you need to know what appendicitis is, etc., etc. Do you have to learn all that stuff as part of your program, or do you have to go through a training in orthodox medicine before you go through a training in natural medicine?
You see, that's where we have a problem in this country. We tend to look at orthodox and alternative as two different things.
Okay.
Medicine is medicine. For you to understand medicine and practice it, ideally, you must understand physiology very well. You must understand the human anatomy. You must know where the kidneys are, where the heart is, what it does, and all that. And that's why after having transversed the two sides,
Okay.
I realized that medicine, the orthodox and alternative, they are two sides of the same coin.
Okay.
Orthodox is on one side of the coin, and alternative and complementary medicine, which we call natural medicine, is on another side.
I just throw one quick question in.
Yes, sir.
Would you, under any circumstances, refuse to prescribe invasive therapy for any condition?
I won't, and I will explain why.
Okay.
In natural medicine, we practice holistic Ayurvedic medicine, which is that's what, in another way, in another terminology, if you can use another terminology for it, it's preventive medicine.
Okay.
Which deals with what you eat. It says let your food be your medicine, and let your medicine be your food. Okay. If you practice Ayurvedic medicine, natural medicine, you won't get yourself to the point where an invasive procedure will be carried out on you.
Now, I want to talk a little bit about the Iris Medical Foundation.
Yes, sir.
You are involved with Iris. What exactly is the Iris Medical Foundation?
Iris Medical Foundation is a health facility and an organization that is involved in natural medicine 100%.
Okay.
We are actually a one-stop health facility. When we say one-stop, it means
You don't need to go anywhere
no
else.
disease is resistant.
So how big is the Iris Medical Foundation?
It's big enough to solve anybody that comes around their health problems.
Now, according to the World Health Organization, 80% of the population of Africa and Asia depend on natural medicine. Now, to the mind of the layman like myself, that means they're drinking agbo. What does it mean?
You're actually voicing out the general misconceptions. Everybody sees natural medicine as an agbo, which we call decoction.
Yeah.
And we refuse to move away from that standpoint. And natural medicine is not about decoction. It's not about agbo. It's a whole gamut of remedies, which the decoction is one of them. We have produced syrups.
Okay.
We produce capsules. We produce ointments. And what we do is, what our remedies is just the other side of what we have in the orthodox end of it.
I've been into shops. The Body Shop is one, for instance. I don't know if you're familiar with it, in the United Kingdom, where they sell natural.
Okay, all right, yeah.
Okay. And I remember somebody, he came to pick me up for a meeting, and his breath was smelling of garlic. And he says, he drinks garlic every morning. Is this part of natural medicine? People who they don't want to take anything that has side effects, that they want to take just natural.
Yes, let me explain. You talked about garlic, which is Allium sativa. That's the botanical name.
Okay.
A lot of people, you see, we consume garlic without understanding the health benefits. You can throw it in your soup and eat it, but the way we apply it as food is different from the way we apply it as a drug, as a medicine. And garlic itself, the Allium sativum, let me use the botanical name, or let me use the general name so that they will understand. Garlic is a very powerful antimicrobial agent.
Okay.
Which is very powerful. When we say antimicrobial, we mean it can inhibit the activity of microorganisms, in the case we're talking about bacteria, fungi, and all that.
Okay.
And the misconceptions we also have is we think by eating one lobe of garlic, all our problems will disappear. No, you have to comply.
Now, just before we go on a break,
yes, sir.
How does somebody who's watching this program get to meet a natural health practitioner?
Such an individual has to come to either IRIS,
okay,
or any other accredited naturopathic clinic.
Okay, and there's some sort of website or?
You can actually visit MDCN websites.
Okay.
And then we have the National Association of Alternative and Complementary Medical Practitioners, NACAMA, and we have associations like that. There's quite a lot of them.
Okay. We have to go on a break now. Viewers, we're talking to Dr. Mobolaji Balogun. We'll be back in a moment, so stay tuned.
What is natural medicine? If you may ask, it is just the healthcare systems and methods that focuses on natural remedies and methods, and we de-emphasize surgery.
We say natural medicine is evidence-based medicine because you're treating somebody, you're getting results. Over time, there were so many cases that, conventional medicine will not actually address. Cases like, cancer, fibroid, tumors and everything, and alternative medicine was handling it perfectly well. So, there was this renaissance, you understand, this rebirth on medicine, and natural medicine is getting acceptance into the mainstream of medicine. But having medical doctors out there in Nigeria, when they've had cases and, they give us a call that, I think we've done what we can with this particular case. Take over and see what you can do. You understand? We've been getting much major success with such cases.
Drugs have side effects because we preserve drugs, but natural medicine, we didn't preserve it. We just cut at the boost and drink. So it will work and it doesn't have side effects.
Mo lè lo oògùn bílẹ̀ dáadáa náà nítorí oògùn bílẹ̀ náà fi wò mí láti kéré ti fi dé àgbà bọ̀ kí n tó di pé mo ń lo àwọn oògùn òyìnbó àmọ́ tó bá lè manufacture oògùn bílẹ̀ wa bíi tàwọn òyìnbó tó máa easy tí ò ní máa bitter lẹ́nu you understand nísìn ó máa easy fún wa nítorí differentiate tó wà ń bẹ̀ náà ju pé tábánikà lo apps wa ó máa ń bitter ní lẹ́nu ní many people ṣe máa ń resist but tó bá yẹ pé nǹkan tẹ́ pé a máa swallow tá máa fomi mì ó máa easy gan so anybody tó bá lè try láti manufacture tiẹ̀ báwọn òyìnbó ṣe máa manufacture tiwọn tó lè jẹ́ pé nǹkan tó yẹ fi cure tó bá ti ṣe nǹkan tó yẹ à ń fẹ́ anybody lè dance to the tune.
There's many companies that produce traditional one that they are using mixing it together. Those ones are good. These people, they have a side effects because they preserve it. That's what I want you to know. Anything they use preservation on it, know how we have side effects.
You're welcome back to the Heart of the Matter, where we're talking about natural medicine. And our guest on air with us right now is Dr. Bolaji Balogun, Dr. Mobolaji Balogun, who is a natural path. Okay. Now, Dr. Balogun, let us say somebody came to you with cancer, and let me pick the two probably most common cancers in women, breast cancer, or in men, prostate. How would you go about it? What would you do?
At high risk, what we'll do, cancer itself is not such a big deal. Most people have been condemned to a life of misery because of that. But at high risk, we were privileged to have access to one very important remedy, one of which is what we call fibroma capsules. We call that fibroma capsules, which is an anti-tumor agent.
Okay.
Now, when we manage patients in a natural perspective, we don't just apply one single medication.
Okay.
We don't. It's an holistic approach itself. If you've been having a problem, for instance, for 10 years, in Ayurvedic holistic medicine, you must take medications for minimum of 10 months. But we have drugs within 6 weeks that will clear it. Okay. If you take the other drugs, orthodox ones, antimicrobial agents, you easily develop resistance. Because in our case here, we compound those drugs with about an average of 16 different herbs.
Okay. Now let's talk about other conditions such as are common in our society: hypertension, diabetes. Yeah. What would the natural
the approach be? When we talk about hypertension, hypertension is one thing that's very prevalent in our society. And of course, if you go into the statistics, you realize that it's more prevalent among the black people. People of African descent.
Okay.
People of African descent worldwide. And you realize that by the time most people discover they have the problem, it will have degenerated, it would have created some complications. Atherosclerosis would have set in some cases. Heart disease would have set in. In natural medicine, those who have an opportunity to get in contact with us early enough will prevent them from ever having that.
Last question.
Yes, sir.
What would you like our viewers to know about natural medicine that we probably haven't talked about so far?
I want to tell them at home, wherever they are at this moment, that natural medicine is not longer a propaganda. it's a real and potent healthcare delivery system.
Dr. Mobolaji Balogun, we're grateful to have had you on the program. I hope our viewers have had a change of heart, or at the very least have come to a new understanding about natural healthcare. Viewers, stay tuned. We'll be back with our next guest. Thanks ever so much.
Thank you so much. Thank you so much.
Welcome back to the Heart of the Matter, where we're talking about health. With me now is Dr. Dayo Ajayobe, who is a pediatrician. She's also got a lot of experience in public health and so on and so forth. And so it's a privilege to have her on the Heart of the Matter. Welcome, Dr. Ajayobe, to the Heart of the Matter.
Thank you.
Because you're a pediatrician, and I know that you want to talk to us about tips on public health, but because you're a pediatrician, I want to ask you first of all about children. Because, as the song says, children are our future. If we don't look after them, if we don't look after their health, it's going to affect our future. And Nigeria, sadly, has an infant mortality rate of 20%. That is, 1 in every 5 children will die before they are 5 years old. What's the problem and what's the solution?
The problem, obviously, just as you said, it's a high wastage. A woman gets pregnant 9 months and ends up at the age of 5. 20% of them, the children will die.
Yeah.
The main problems are infection.
Infection. What
and
sort
the vast majority of infections can be prevented if children are adequately immunized. We have 9 immunizations. The major problems are measles. You have tetanus is another one. The other ones that you have are diarrhea, major cause.
Chickenpox.
Chickenpox down the line.
Okay.
But these ones, yes, are the major ones. You have diphtheria, which is less of a problem. Polio is another problem, although it's more when it comes to disability. So the 9 vaccinable conditions are the major causes of death in children. Malnutrition is also a big one as well.
Okay. So if we immunized more children,
Yes.
that would go a long way towards solving the problem.
Yes.
Then you said malnutrition.
Yes.
Can you tell us what malnutrition is?
Well, children don't get enough food.
Okay. They're not getting enough food or the right food.
Enough. Enough. It could be enough or too much.
Okay.
But talking about it, majority of nutrition is a big problem in Nigeria when it comes to the vast 150 million people. So they're not getting enough.
Okay.
And also infection also adds, if a child falls ill, it's more like not to eat, and that will contribute to malnutrition as well.
Okay. So at this stage, for us as a nation, it's just about enough food. Because I used to hear about balanced diet. And if you didn't get a balanced diet, that could also contribute to
enough food. Yes, balanced diet as well. The right food as well, important. Yes.
Because I know that we used to. I mean, in England they talk about meat and 2 veg.
Yes.
Okay. So malnutrition is a major cause.
Yes.
Of infant mortality. Yes. What about just access to healthcare? Does that have any bearing on it?
Yes, access with a vast majority of Nigerians, at least I'm sure, 80% of Nigerians don't have proper access to quality healthcare.
Okay, so that cases of sicknesses that easily could be
managed,
treated,
yes,
just can't get because.
Yes.
Okay, now what about the cures? I mean, in a sense, you've also mentioned the problem, and the solution is just immunization.
Immunization is very important for preventive purposes. Treatment, the right treatment, the right ways of treating. Healthcare, Nigeria produces about probably 2,000 doctors a year.
Okay.
For a population of 150 million.
2,000 doctors a year?
Yes, there are probably about 50,000 doctors in Nigeria at the moment for 150 million people, which is way below the WHO numbers.
That's a huge
gap.
Huge gap.
Yes.
And that also means, because out of all the doctors that qualify,
Yeah.
a few of them end up in Saudi Arabia
Yes.
and other countries
Yes.
because they simply aren't receiving the kind of package
Yes.
that they should in Nigeria. Now, something really foundational, fundamental. I've noticed that a lot of children will use the toilet,
Yes.
and then you see them 10 seconds and they're out of the bathroom. They've not been taught to wash their hands.
Yes.
And I find that in our society, we just don't wash our hands enough. Would something as simple as washing your hands properly solve or go a long way towards solving the problem?
Well, definitely. I mean, washing your hands, soap, water, when you come in contact with whatever dirt, you are supposed to actually wash your hands.
I
But-
watched a doctor on television in England say that while you're washing your hands, you should wash your hands as long as it takes for you to sing the national anthem.
Yes.
So it's not just a question of putting your hand
No.
on. You know. Okay. Let's talk about health, lifestyle tips to stay healthy. Okay. First of all, I mean, there's been a lot of attention given to obesity. Let's start by defining obesity. What is obesity?
Obesity is being overweight. Basically, you have overweight and then obese. A child who is overweight, a person who is overweight, it could be due to excessive fat, excessive muscle weight, or excessive water, or all three of them. Obesity is
Excessive fat,
muscle
or
weight,
water.
or water. That's overweight. Being obese is fat, pure fat,
Okay.
and you're usually above the 85th centile.
Okay. What is the 85th?
Okay, you've got the body mass index.
Okay.
It's a formula where you have your weight and you have your height
Height.
squared,
Okay. Okay.
and you follow it. Yeah, they have it all. There are different ranges,
Okay.
and when you're obese, you're in a certain range.
Range. Okay. What does one do to prevent? Or let me start with the root of obesity. What causes obesity?
All right. Obesity, the cause is when your consumption of calories is greater than you're burning off these calories, and it's becoming an increasing problem in children. Nobody used to look at it before, particularly in the upper social class. In the States, about 30%.
Burgers and,
yes, fast foods,
fast foods.
KFC. So I shouldn't mention. I
okay.
should mention them.
It's okay. Go
But
ahead.
yes, the fast food is a big fast food industry, which is big. It's a big marketing strategy.
Become a big market in Nigeria as
Yes,
well.
exactly.
So that could be one of the contributory factors.
Other factors, obviously, is family history. It runs in families. Other ones are genetic and hormonal problems in a few cases. So it's always nice to get checked out just to make sure it's not
A hormonal
a
problem.
problem. Yes.
Okay. What can one do to prevent it?
Prevent, as you said, well-balanced diet. Vegetables, fruits, being present in every meal. The whole thing is about 5 fruits a day. I don't know how feasible it is, but 5 fruits or vegetables a day
Okay.
is what is the. The other thing is children now. Actually, everybody, the
They
society.
hate vegetables.
Yes, they do. And like, if you can remember, eat your vegetables. It's always getting children to eat their vegetables. But you have to keep on insisting and then giving them fruits as well.
I saw one school where they turn the vegetables to a different color because they don't want green. And so by making them gray or red or something,
So they take it.
that attracted the children to them a bit more. So, okay, now somebody once told me about some of the problems people have because of the level of diesel or fumes
Yes.
that they're inhaling in Nigeria.
Yes.
That you know, our air is polluted, so it can cause asthma in some people. What can we do to help children who
Well,
have these?
Asthma. Asthma worldwide is a big problem. I think it's 10 to 13% of children will come down with asthma. And clinical practice, in my last 1 year, then the numbers are rising in Nigeria. And I think it's largely due to the pollution that's in the environment. Generators
Okay.
booming away. I don't know how much what you can do. Probably sort out the electricity.
Yeah, but also there is something else. I think maybe if parents located their generators
Away.
away from the home, where it wouldn't. And another little thing is the air conditioner you use at home, for those who use air conditioners, could just be turned to recirculate the air that is inside instead of bringing air from the outside.
True.
Maybe that will help. Dr. Ajayibo, it's been great having you on the Heart of the Matter. We are more enlightened for having you, and we want to say a great big thank you to you for coming to the Heart of the Matter. Viewers, I hope you enjoyed this program. We'll be back again same time next week, and until then, stay mightily blessed.